genitourinary gland. When we discuss the genitourinary system of the female, we are considering the first cervix, then the endometrium, then the myometrium, then the ovaries, and last the fallopian tubes. We will begin our discussion about the cervix. As you know, as far as you know, the cervix is composed of either endocervix or ectocervix. We are here looking at the ectocervix, which is composed of squamous epithelial cells. Those cells are squamous cells and they are stratified. So this is a stratified squamous cell epithelium. Are those keratinized or non-keratinized? Anyone know?
Keratinized?
Non-keratinized. There is no keratinization at the surface. Usually the keratinized squamous cell found on the exposed area, for example the skin, to protect it. So the ectocervix is not exposed to the air, so it shouldn't be keratinized. So this is a squamous epithelium of the stratified squamous non-keratinized, which is normal in the ectocervix. There is an abnormality in this slide. This is also an ectocervix. As you see, this is a squamous, stratified squamous epithelium, and there is an infiltrating lesion. The infiltrating lesion is composed of small cells like lymphocytes and hemorrhage. So this is an inflammatory process occur in the cervix, and it is usually cervicitis. Okay, which can be caused by infection or any other cause. As you know, some viruses can infect the cervix. For example, the human papilloma virus, HPV virus, and the HPV virus cause the cervical epithelium to become, as what we say, coilocytosis. Coilocytosis means ballooning of the cells. So there is enlargement of the cell, and cells looks like it is ballooning. And this is a characteristic feature of the HPV. Also, as you know, the HPV infected cells can precursor to dysplasia and carcinoma of the cervix. Okay. So, when we are talking about dysplasia, what is the meaning of dysplasia? Yes. Dysplasia. What is the difference between dysplasia and normal tissue? Changing, okay. They're disorganized cells. They are abnormal cells, okay, toward the malignancy. So they are not normal. In dysplasia, the cells are not like normal. For example, if we look at the surface ectocervical tissue, those cells are not as dense as those nuclei. For example, those are called hyperchromatic. Hyperchromatic means increase in the pigment or increase in the staining of the cells. So it's hyperchromatic. So the cells are hyperchromatic here, but the hyperchromasia or the dysplasia is not extending throughout the cervix. Okay? So it is just at the lower third. When it is just at the lower third, we call it grade 1 dysplasia or mild dysplasia. Okay? Those also atypical cells, these plastic cells, are not just occupying the lower third, they are extending into the lower half or the upper or the lower 2/3. It's a grade 2 dysplasia, okay? And as we expect the grade 3 dysplasia, it occupies all the length or all the strength of the ectocervix. All those cells from the basal layer to the superficial layer are these plastic cells. So it is a high grade dysplasia or grade 3 dysplasia, okay? Okay, this slide shows a squamous cell carcinoma. What we know about squamous cell carcinoma, its precursor is high-grade dysplasia. It is converted into squamous cell carcinoma. This type of squamous cell carcinoma, those cells are atypical cells, large, hyperchromatic cells, and forming something called keratin pearls. Keratin pearls inside the squamous nests are abnormal, and they are called keratinizing squamous cell carcinoma. Okay, we can find this keratin either extracellular or intracellular, and this is pathognomonic for keratinizing squamous cell carcinoma. And as you know, most squamous cell carcinomas of the cervix are non-keratinizing. Okay. This type of carcinoma, historical type, it is associated with a drug called diethyl stilbestrol. This drug was used as an antidepressant, and the female using it who were pregnant give birth to a female patient with this type of carcinoma. It is called clear cell carcinoma. Okay. This type of clear cell carcinoma, what do we mean about the clear cell? The cytoplasm is clear. Okay, there is no organisms or organelles in the cytoplasm, so it appears there is no stain inside the cytoplasm, so it appears clear. Okay, or either there is a collagen or fat inside the cell which was dissolute. Okay. So we have finished the cervix. Now we will move on to the endometrium. As you know, the endometrium composed of endometrial gland and endometrial stroma, and the staging of endometrial phase depends on the architecture of what we see in the endometrium. For example, the start of the secretory phase, which means there is a secretory vacuole inside the cells. It starts from the basal, and then in the basal and in the upper part, and then in the upper part of the endometrial gland, and then they are excreted into the lumen of the glands. So when we see basal secretory vacuoles, which means that they are in the underside of the nuclei, it is called early secretory phase endometrium. Okay, this is early secretory phase endometrium. The endometrium of the female may undergo chronic inflammation or acute inflammation, and it is called endometritis. Okay, endometritis means either any cause of infection or inflammation to the endometrium. Some types of inflammation, like TB, tuberculosis, can cause something called granuloma. Granuloma composed of those cells, the pointer pointing at, they are called giant cells. Okay, multinucleated giant cells. And those cells are histiocytes or epithelioid cells, which are activated macrophages, and those are surrounding lymphocytes and maybe plasma cells. So this is a granuloma, and this is a TB affecting the endometrium. Okay. This is a gross specimen of an endometrium which was opened, and those are papillae or fronts extending from the endometrium. Those are called endometrial hyperplasia, which is a precursor of endometrial carcinoma. Those shouldn't be here. The surface of the endometrium should be smooth, and those papillae or fronts are representing the endometrial hyperplasia. This is also another section of the uterus, and this is the endometrium. You see this polypoid structure? This is a polyp. This is a polyp extending from the endometrium, and usually grossly we cannot discriminate between the polyp and the hyperplasia. But under microscope, it is easy to describe the difference between polyp and hyperplasia. Why it is important to distinguish between the polyp and the hyperplasia? Hyperplasia is a precursor for cancer. It should be noted, and the polyp is not a precursor for cancer. Okay. We saw a uterus specimen and the fronts and the papillae, which were slender. Those papillae appears very ugly, and they are representing an adenocarcinoma of the uterus. This is an adenocarcinoma of the endometrium in the uterus. This is another section of the endometrium, which shows the endometrial adenocarcinoma. This infiltrative lesion occur in the endometrium, and the precursor for it is endometrial hyperplasia. Under the microscope, we said that the endometrium composed of either the glands and the stroma, and there usually there is a concordance between the endometrium, glands, and the stroma should be 1:1. If there is an increase in the gland to stroma ratio, there is an increase of hyperplasia and further carcinoma. As we said, as we see here, there is no stroma between the glands. There is a proliferation of glands. The glands are large, atypical, hyperchromatic. There is no stroma between the glands, and they are unusual architecture or structure. So they are representing an adenocarcinoma of the uterus. Now we will discuss the myometrial structures or myometrial diseases of the uterus. The first is the adenomyosis. What do we mean by adenomyosis? There is a proliferation. Adeno means a gland. Meiosis, smooth muscle, and there is a proliferation of glands inside the muscles. As we know, the thickness of the uterus composed of superficial endometrium, then myometrium, then the serosal layer. Usually, the endometrium found in the superficial layer, but when the endometrium is found inside the myometrium, it's called adenomyosis. So there is adenomyosis inside the smooth muscle of the myometrium. They are cystically dilated, abnormal glands found within the smooth muscle of the uterus, and there is a stroma also of the endometrium. So there is a gland and there is a stroma inside the myometrium, which is abnormal. This slide shows the endometriosis. What is the difference between endometriosis and adenomyosis? Ectopic uterine tissue found outside the uterus cavity. Okay, so endometriosis, there is a displacement of endometrial tissue outside the uterine cavity. For example, the uterus, the ovary, the peritoneum, and as the same as adenomyosis, we found a gland and a stroma inside this tissue. For example, this is a fallopian tube. We found on the left here, there are glands and the stroma of the endometrium. Also, we found that, as you know, the cyclical changing of menstrual cycle affect the endometrium inside the uterus and outside the uterus. So the changes can appear in this endometriosis and underwent bleeding. So we found a bleeding inside this gland. So we found a gland, we found a stroma, and we found a bleeding. Okay? We said that we found a bleeding in the cyst, and this is a large endometriotic cyst, which is called chocolate cyst. This chocolate cyst filled with blood due to menstrual cycle that affect the endometrial tissue outside the endometrial cavity, and this is called chocolate cyst. Okay. Now we will move on to the smooth muscle, abnormalities. ايش بتلعب انت انت
سلايدز مش
طيب خليك معنا. Okay, this myometrium, this is the normal myometrium in the left side, and this is the abnormality. As we see, we cannot discriminate between, distinguish between the abnormality and the normal, because those are totally benign lesions found in the myometrium, which is called fibroid or fibroids. Those fibroids are proliferation of smooth muscle of the myometrium. Okay, and they are, as we see, they are pushing the normal myometrium to the left. They are well circumscribed lesion of the myometrium and bland, normally looking cells, and they are pushing the myometrium. When we look at the other lesion of the myometrium, which is called leiomyosarcoma, it's a malignant tumor of the myometrium. Leiomyosarcoma means that the cells are not normal. Those cells are hyperchromatic, pleomorphic, and shows a lot of mitosis or mitotic figures. This hypnotic cells is a mitosis. This is mitosis. This is unusual, abnormal mitosis. This is mitosis. So when we are looking at the myometrial specimen, we look first if we found coagulative necrosis, which means there is a leiomyosarcoma first, coagulative necrosis, then pleomorphism or atypical cells, then we count the mitotic figures. Okay? If we found those three, we call it leiomyosarcoma. Okay? At the higher power, we are seeing here this mitosis. This is abnormal mitosis found in this tissue or in this myometrium, and usually representing a leiomyosarcoma. And those large atypical cells and those mitosis, this is a pleomorphism or atypia. So we said that there is first coagulative necrosis, then atypia, then mitotic figures. And there is a number of the mitotic figures. They are above 10 per high power field. Okay? Now we will move on to the fallopian tubes. The fallopian tube usually a slender tissue, but when there is an ectopic pregnancy occur inside the fallopian tube, it is distended and filled with the blood. This gross specimen represents a fallopian tube filled with embryonic cyst or an embryo inside, and this is what is called ectopic pregnancy. Now we will move on to the ovarian tumor. Either are benign tumor or malignant tumors. One of the benign tumors is the fibroma of the uterus, fibroma of the ovary, sorry. This is the normal ovary, and this is the fibroma of the ovary. It's a benign structure found within the ovary and replace all the tissue of the ovary. When we open it, there is a white homogeneous cut surface, and this fibroma can be missed and can be found incidentally. Okay, they produce no symptoms. The other lesion is called serous cystadenoma. Serous means clear fluid. Cystadenoma means that there is a cyst formation inside the ovary. This cyst was opened, and as you see here, there is a clear fluid. There is thin walled cyst, and there is a papillae here at the upper right side of the slide. So this is serous cystadenoma. When we found the mucin inside this cyst, we called it mucinous cystadenoma. Okay? This is another type of serous cystadenoma which shows papillary fronts. This is a papillary serous cystadenoma. Clear fluid and papillae projecting from the cyst wall. They are papillae, and this is papillary cystadenoma. This slide shows papillary cystadenocarcinoma. It is not serous cystadenoma, but serous cystadenocarcinoma. So it is a malignant counter of the serous cystadenoma. It's converted into serous cystadenocarcinoma. Those cells are large, hyperchromatic, the distortion of the architecture of the gland, and those calcification or calcified areas are called samoma bodies. Those areas found on the tip of the papillae. Papillae composed of fibrovascular core, fibrous tissue. Inside the fibrous tissue is blood vessels, and around this fibrous tissue there is cells. Those are called the papillae. Usually the tip of the papillae underwent calcification due to decreased blood supply. So it's called samoma bodies. And when we found samoma bodies, it's usually a papillary lesion. We can find papillary or samoma bodies where we can find papillary other than the cystadenocarcinoma. Papillary, yes, thyroid, papillary thyroid carcinoma. Those cells are the granulosa cells. Granulosa, as you know, granulosa is one part of the ovarian follicle. Those are granulosa cell tumors arranged in follicle-like structure. They show the clearing of the cytoplasm and the cleaving and prominent nucleolus, and they are forming a primitive follicles. Okay, there are a lot of follicles. We should, or we can found 1 or 2 or 3 follicles inside the ovary, but there is a proliferation of this follicle-like structure within the ovary, occupy most of the ovary. So it is called a follicular carcinoma, or called follicular or granulosa cell tumor. This slide shows 2 ovaries filled with a lesion. This lesion is called teratoma. Teratoma means there is a proliferation of multi-lineage of cells, the ectoderm, the mesoderm, and the endoderm. For example, the ectoderm, what we can find in teratoma from the ectoderm, hair follicle, we can find skin, we can find neural tissue, okay? From the mesoderm, bone, muscle, Okay, cartilage, we can find cartilage. From the endoderm, any intestinal structure or intestinal epithelium. Okay, so this is called a teratoma. Usually it's benign teratoma, found bilateral within the ovary. We can find teeth inside this teratoma also. This specimen or this tissue, there is an ovary here and there is a uterus here. This ovary is occupied or replaced by a lesion which is teratoma. We can see here the hair follicles and some fat tissue. This uterus is having a fibroid or a leiomyoma inside the uterus, and this ovary, which is the left ovary, shows a fibroma inside the ovary. So this is teratoma, leiomyoma, and fibroma within the same patient. We said that the teratoma composed of ectoderm, mesoderm, and endoderm cells, so we can find any type of cells. We say, if we look here, this is a cartilage, those are intestinal cells, those are fat cells, and this tissue represents thyroid tissue. It's called stroma ovary, and it is abnormal thyroid tissue found in the ovary as a part of teratoma and can cause hyperthyroidism. It's called stroma ovary. Okay, we have finished the female genital system. Now we will move on to the breast. Breast lesions are either benign lesions or malignant lesions. The first benign lesion is called fibrocystic change. It is occurred usually in young age female. There is a cyst maybe filled with fluid. When we call this is a fibrocystic change, we mean usually something called fibrosis, adenosis, and apocrine metaplasia. Those are found in the fibrocystic changes which occur due to hormonal changes in the female body, occur in the breast tissue. So there is a cyst formation, adenosis, fibrosis, and apocrine metaplasia. This proliferation of epithelial cells, as you know, the breast tissue composed either of duct lobules and stromal cells. When the duct part of the breast tissue underwent proliferation, normal proliferation, it is called hyperplasia. Usually the duct composed of 1 or 2 cell layers and surrounded by cells called myoepithelial layers. When there is a proliferation or a hyperplasia, which is completely benign lesion of the breast, there is a proliferation of both the epithelial cells and the myoepithelial cells. So there is a proliferation of 2 types of cells. When we found proliferation of 1 cell type, it's a precursor for cancer and called ductal carcinoma inside. Okay, so the proliferation in the hyperplasia is in 2 cells, the myoepithelial cells and the epithelial cells. The myoepithelial cells usually surround the exterior portion of the duct, and the epithelial cells found inside. Okay. This is another type of benign lesion of the breast, and it is the most common lesion found in the benign breast lesion in the breast. It is called a fibroadenoma. As we said, 2 components of the breast, either ductal tissue or lobular tissue and the stromal. There is a proliferation of the stromal part. Stromal part of the the breast tissue composed of fibroblasts, those underwent a proliferation, which caused compressing of the ducts. Also, the growth factors secreted by those fibroblasts can affect the glandular epithelium and cause a proliferation. So we saw mainly proliferation of the fibroblast, then we saw slight proliferation of the epithelial cells. This is another type of fibroadenoma, or another picture of fibroadenoma. There is a fibrosis or a development of fibrous tissue outside the ducts, which cause compression of those ducts. And this is another lesion of the breast, which is called intraductal papilloma. Usually, this is the duct epithelium outside, and there is a papillae attachment to this duct at this part. Okay, this is the duct epithelium, and this papillae is attached to this part of the duct, and it is called intraductal papilloma. And this is a main cause of hemorrhage secretion from the nipple. Intraductal papilloma. Okay. Now we will move on to the cancers of the breast. The first is infiltrating ductal carcinoma or invasive ductal carcinoma. This gross specimen represents a breast tissue, and this lesion is poorly circumscribed, infiltrative, white lesion in the breast. If we touch it, it is usually firm to hard, not as soft as this normal breast tissue, and this represents mainly usually ductal carcinoma or invasive carcinoma of the breast. This microscopic picture shows something called comedonecrosis. Comedo means necrosis inside the gland. Usually some superficial gland underwent necrosis and caused necrotic debris inside the gland. It is called comedonecrosis, and it is usually a high-grade type of carcinoma or ductal carcinoma in situ. So in comedonecrosis, we found abnormal or malignant cells, and there is inside those glands necrotic tissue represent acute and chronic inflammation and the slough of tumor cells. This is called the comedonecrosis. This picture represents infiltrative or invasive ductal carcinoma. Usually, as we say, there is a lobule and the ducts, and there is a stroma, usually lobular terminal ductal lobular unit, composed of lobules and ducts. And this lesion doesn't form any kind of lobule or duct. There is a single cells infiltrating between this stroma, and those cells are infiltrative, and they are cancer, malignant cells infiltrating between the stroma of the cells. And this lesion is called calcification, microcalcification. It is usually found when we did X-ray of the breast, we found microcalcification, and this represents microcalcification of the breast found in the microscopic examination. When we look at the high power of the breast cancer, those cells are large, atypical, they are infiltrating, and there is something called desmoplastic reaction. Desmoplastic reaction means that the cells secrete a fibrous tissue to push away the tumor cells. And this is a fibrous tissue between the tumor cells, which is not normally found in the normal breast. It is called desmoplastic reaction, secreted by fibroblasts found in the stroma. Secrete desmoplastic reaction or secrete this type of collagen. And as we see here, there is a nerve or a nerve bundle, and there is something called perineural invasion. Perineural invasion means that the glands or the tumor cells around or attacking the gland, and it is a poor prognostic sign if we found either perineural invasion or lymphovascular invasion. Lymphovascular invasion means that there is a tumor cells inside the blood vessel or the lymphatic, which means that the cells may metastasize to the blood or metastasize to the lymph node. This is the LVI or lymphovascular invasion. Other types of carcinoma of the breast are called lobular carcinoma. Lobular carcinoma means that the cells are discohesive and shows an Indian file appearance. Those cells are discohesive and are not usually attached to the cells. Usually something called E-cadherin, which maintain the intracellular connection between the cells is lost, and when it is lost, the cells are usually discohesive and infiltrate through this kind of infiltration, which is called Indian file infiltration, and this represents a lobular carcinoma of the breast. This is another variant of carcinoma of the breast. This is called the medullary carcinoma of the breast. Medullary carcinoma of the breast means there is a multi-nucleation of the cells, there is loss of borders, and there is a great or abundant lymphocytic infiltration, and the tumor is not usually infiltrative, it has a pushing border. The difference between the pushing border and the infiltrative, as we say, in infiltrative or invasive ductal carcinoma, single cells are infiltrating between the stroma. But the pushing border, the whole tumor pushing the normal tissue to one side. Okay? This is a pushing border. So the medullary carcinoma has a pushing border, has a multinucleation or syncytium called, and has a lymphocytic infiltration. This benign tumor of the breast is called phylloides tumor. It is another lesion that has a proliferative or a proliferation of the stromal cells, but it's usually higher grade than the fibroadenoma, and the glands appears like leaf-like lesions or leaf-like, and this is the phylloides tumor. It is usually in young age and represents a very large mass of the breast. As we said, it is called the leaf-like appearance. Okay, the last slide. Some ductal cells or ductal carcinoma cells shows infiltration of the epidermis. So it represents something called Paget disease of the breast. Usually the epidermis composed of squamous cells which arranged as this slide, but those abnormal, large, hyperchromatic cells which are found in the basal layer of the epidermis represent a Paget disease of the breast. And it is, if we found a Paget disease of the breast, usually there is an infiltrative ductal carcinoma within the breast. There is hyperkeratosis, means in the upper side of the epidermis, which means increase the keratinized layer of the breast. Okay, thank you. Any question?